You do not have to wait for a crisis to start the hospice conversation. Here's three signs you may want to start that conversation. Number one, they're going to the hospital more often. If someone is having repeated hospitalizations, ER visits, infections, falls, or other complications from an advanced illness or disease, it may be time to ask, are we still treating the disease, or are we reaching a point where comfort should become the priority? Sign number two is the day to day life that they are living is changing significantly. What I mean by this is you may start to notice that they're sleeping more, they're eating and drinking less, they're becoming weaker, they need more help with their daily activities such as bathing, dressing, walking, getting out of bed. Those things are starting to change, and you're starting to notice that maybe the illness is progressing in some way. Sign number three is you're noticing that caregiving is becoming overwhelming. If you're constantly worried about what to do next, you're managing all the medications around the clock, you're afraid of what will happen if something changes, or if you simply feel like you can't do this alone anymore, there's a reason to have that conversation. And just because you have that conversation, it doesn't mean that you're giving up. You're just looking into other options or options that may be coming down the line that you have. People don't know what hospice really provides. So it's good to just start that conversation so you know what your options are going to be. So, hospice can provide nursing support, medications related to the terminal diagnosis to make them more comfortable. They provide equipment, education, emotional support, not just for the patient, but also for the family, and guidance for the entire family. And it's best to have this conversation before you're in the middle of a crisis. You don't have to decide today that hospice is the answer right now. Sometimes the first step is just asking, would hospice be appropriate for my loved one right now? The conversation may give your family options you didn't even know that you had.